Hey everyone, welcome back to the NPTE podcast. This is Will Crane, your host. Thank you so much for joining me as we go through the content you need in order to dominate on test day. So today we're going through a little bit of the NPTE mindset and how to hack your NPTE mindset to get in the right mindset and understand how they are writing and creating these questions. But before we get that, just a quick reminder that we will be starting up our crash course for our PTs starting up the first week of July. This is a great way to study the cardio, musculo, and neuro sections of the exam one more time. As you recall, this comprises about 75% of the exam on test day. So really, and this is one of the things I tell students all the time, is be sure to study proportionately. Make sure you're spending about 75% of your time in the cardio, musculo, and neuro systems. So the reason the crash course is such a fun one is because not only is it abbreviated, it's a great way to go through most of the content very, very quickly. It's extremely inexpensive. If you have groups of 5 or more, we've got a sweet discount for you. You can reach out to us over at ptfinalexam.com/contact if you have a group or a cohort you'd like to get through. Plus, we know that cramming doesn't work, that if you study something the night before the test, it tends to be detrimental or to be counterproductive. In this case, we start about 3 weeks before test day, goes through the main content on exam day. We have a bunch of pre-recorded material as well as some live sessions to take you through practice questions related to exam day. So not only are we helping you with the content preparation, but also we're helping you with the application of that content via practice question. And then usually we like to throw in a few bonus or added features. We'll hold that as a surprise once you're a part of the class, but we always like to add a little bit of bonus content in there as well. But in the meantime, be sure to check it out over at ptfinalexam.com. You can find out all of our course options, including our crash course, which again is extremely inexpensive and a great way to study for the test right before test day. Can't tell you the number of students, the thousands of students we've had come through this class and have said this was just the ticket, just what I needed. It was like the cherry on top, get me right through test day, got me a bunch of questions more correct that I wouldn't have gotten. In fact, I have people all the time say, hey, Will, what you said showed up on test day, and I was so glad that we mentioned it because otherwise I would have forgotten it. So be sure to check it out, ptfinalexam.com. You can find out all the course offerings we have and join our crash course. All right, so today we're just talking about the NPTE mindset and how to hack the NPTE mindset. So what do I mean by that? I mean, you need to think and understand what the writers of the test are thinking and understanding. So think of it this way. I remember having an English class in my undergraduate program where there was a professor who, we were going through classic literature and, just kind of your standard literature in English class. And the first test, no one knew what to expect because we'd never taken a test from this professor. However, the second test, we knew exactly what to expect because we had seen what was on the first test. We had a good mindset of what this professor was looking for. Now, in this case, for our example, or for our case, the NPTE, it is written by your peer PTs. It's not written by anyone else. It is the first draft of every question comes from a licensed PT in the United States across the practice spectrum, across all walks of life, fully diverse item writers that write the first draft of the questions considering what you need to know as a first year or entry-level PT. In fact, that's the main scope of the NPT is to, number one, ensure that individuals who are taking the NPT have the requisite knowledge of physical therapy and are licensed in the physical therapy field. And then the other thing it does, it helps to standardize the PT experience across the United States, across all jurisdictions. So it says to help regulatory authorities evaluate candidates and provide standards that are comparable from jurisdiction to jurisdiction, meaning that a PT in New York would be equivalent to a PT in Pennsylvania or in California or whatever jurisdiction, that all the standards are unified across all jurisdictions. So that is the purpose of the NPT. Again, each item is written by one of your peer PTs, and chances are once you get through the NPT, maybe someday you'll want to volunteer and write items for the NPTE. Now, of note, it does take about 2 years for an NPTE item to actually show up on your test because it goes through about 8 different committees. It goes through a lot of editing processes. They want to make sure all the wording is clear. And then eventually it rolls out as a pretest or unscored item on your test so that they can evaluate that people who pass the test get that question right, people who fail the test get that question wrong. They evaluate it through some very robust statistical measures. And then the eventual goal is that they want to make sure that every PT or PTA is safe, direct, and effective. So with that mindset, that can often help you as you're answering questions on the exam. What is the safest, most direct, and effective way to treat this patient? So every question on the NPT is written in a clinical scenario, meaning that it is a patient case. A patient has this, a patient is experiencing this. You are evaluating a patient with XYZ. Now, your job is to identify safe, direct, and effective ways to treat that patient. So some considerations when you are looking through a practice question. Number one, consider what would the most textbook answer be to this question. So what I mean by that is what would be the most standard question or most standard answer to that question. Consider what the most reasonable of reasonable PTs would say in this case. So if you were to think about, I don't know, maybe the PT you look up to the most, what would that PT say in this particular case? And chances are your PT friend would say, well, that depends. But really, again, speaking very frankly here, you have to consider what would the textbook say in this case. So consider what the most reasonable textbook answer would be. Another thing to consider is there an order of operations that needs to be considered? Meaning, do we need to gather more information first before evaluation and intervention? Is there one intervention that you would do first versus the next intervention? Let's see. Are there other considerations that need to be done in an order, meaning that you need to, make sure that the patient is safe before continuing with the treatment? A silly example would be make sure they have their assistive device properly placed before beginning ambulation training. That maybe is a silly example. Maybe one that is a more apt example would be for lymphedema. We talked about this in a previous question. The typical order of operations is that you want to apply compression bandaging before performing therapeutic exercise. This is because that compression bandaging can assist with the muscle pump action in evacuating the lymphatic fluid. And so there is a definite order of operations that need to be done. And so that's one of the things that you should consider on test questions, especially tricky ones where you don't know or you feel like there are multiple correct answers. Ask yourself, is there one that could be done better or more safely before the other? Another thing to consider is that there will be questions that ask you to consider what would you do next in this case of, would you call another healthcare provider, make expeditious referral, call 911? And this is one to consider where, have I done all that I can do as a PT? So what do I mean by that? That means that if you are, the classic example I give is that let's say a patient comes into the clinic and they say, hey, I've got retrosternal chest pain or what appears to be angina pectoris. Now, you may be tempted to say, oh, that sounds like a heart attack, we're calling 911. However, you could also consider that symptoms of gastroesophageal reflux disease can appear to be retrosternal chest pain. And so you'd want to question the patient about the character of the symptoms, or at least get a little bit more of the history saying, oh yeah, I just had the double spicy baby back ribs and I get this after every spicy meal, versus someone who just walked up the stairs and says, yeah, my pain is way worse with activity and better with rest. All that helps you make a better determination about what you would do next. So generally speaking, you want to do as much as you can as a PT before calling 911 or abdicating care is what they say, meaning that you want to do all that you can do before bringing in other healthcare providers. Now, that being said, there will be answers where you will need to call another healthcare provider or you will need to call 911. Don't get me wrong, but they are testing you on what you would do more often than who you would call. Just as a general consideration, more often considering what you would do rather than who you'd call. The other thing is, are you being safe with the patient? So you have to be very careful of overly optimistic answer options, meaning, this abnormal sign appears. What would you do? Answer one is continue therapy, monitoring symptoms or something. That could be the answer, but just be cautious of those overly optimistic answer options, meaning that if they've got, like back to the retrosternal chest pain, they've got retrosternal chest pain, one of the answer options is continue treatment with no changes. You're like, well, retrosternal chest pain is it's really bad news in both cases, whether it's reflux or whether it's a heart attack. But in both those cases, you'd want to at least do something or make some consideration rather than just be overly optimistic. And then also be very cautious about the call 911 option or the activate the emergency response. There will be answers where you'll need to do that, but just remember, they want to see what you will do. So generally speaking, it needs to be very clear in the question what the course of action would be, meaning that if you already have all the information, so let's say the guy comes in with retrosternal chest pain, he reports that it's worse with activity, or even worse, he says that it has a crescendo-decrescendo effect with no relation to activity and no relation to meals. That starts to sound a lot like unstable angina pectoris, which is one of the clear indicators of a heart attack. And that would be a call 911 case. So clearly there will be call 911. Another example would be in the case of autonomic dysreflexia, someone who has the uncontrolled spike in blood pressure and you cannot control it. There's no immediately available or immediately apparent cause for the sympathetic nervous system activation or the autonomic dysreflexia. Absolutely calling 911 in that case. So those are some clear cases where 911 would be called. So the other thing just to keep in mind as far as the mindset goes, the last thing that I like to remind students of is just remember that you enjoy this content, you learned it well. I can't tell you the number of students I've had who've said, hey, I struggle on standardized tests, but my patients love me. I feel like I'm a fabulous clinician. And so just keep that in mind that you are fabulous at this. You're fabulous. You enjoy this content. You've learned it well over the last few years. And then remember, the final thing is that there is a correct answer and you can find it. There is a correct answer and you can find it. So with that positive can-do type of attitude, it makes it a lot easier to identify what the correct answer is. And so that's the key, is just making sure that you are doing your very best to be the safe, direct, and effective PT that you know you are, so that you can answer each question correctly on test day. All right, so with that, we'll bring today to a conclusion, a quick episode about hacking the NPTE mindset. So remember, take all this into account on your practice questions as well, so you can have a better experience on those practice questions and you can boost your score bit by bit. If you need more resources, be sure to check out ptfinalexam.com/podcast, where you get all of our freebies and tips and tricks to get you through the NPTE. And in the meantime, keep a grin on your chin. Happy studying. I'll catch you in the next episode. Will Crane fist pumps all around.